In today's Health Smart, we're talking about a recall on a certain type of breast implant because of a link to a rare form of cancer.
Yes, joining us now here to talk about the recall is board-certified plastic surgeon Dr. Stuart Linder. Good to see you.
Thank you for having me.
This is really interesting. So there is this recall. It's a small portion of an implant, but there is a difference between the implant that some people may be familiar with.
That's exactly right. And the difference is the shell of the bags. We're dealing with a smooth and textured.
Okay.
So all of this news that we're hearing about has to do with this fuzzy coated textured implant.
It's not technically fuzzy, but it's more just like a little bit. It's almost like really non-sandpaper.
It is. Yeah. It's a rougher surface. It's like sandpaper, and it adheres to the tissue. That's why it was created as a textured coating.
Oh.
What is it about this particular implant that would cause cancer?
There's some form of chemical reaction that is occurring with the textured coating of the implant and the body itself. And as a result, it's leading to a very rare form of cancer called anaplastic large cell lymphoma, ALCL. Other countries went ahead in Europe and took these off the market. Now the United States has, as of last week.
Oh, so as of last week.
That's right.
Okay, so they all. What if a woman, got breast implants 7 years ago or 10 years ago? How does she know which one she has?
It's an excellent question, and it really depends upon if the patient has the card. In my practice in Beverly Hills, we give every patient a card. The card's going to have a catalog lot number. It's going to tell whether it's textured or smooth. 95% of the implants in the United States are smooth, not fuzzy. But if she has that card, bring it to the plastic surgeon, we can tell what type of implant it is.
What do you do if you have it?
If you have a textured implant, well, the FDA at this time does not recommend removing them unless you're symptomatic.
Okay.
And what would that, would it feel like, soreness or what?
Exactly, be swelling, soreness, and scar tissue, hardening around the implant.
But that still could come.
That's right. The most common complaint and problem we have as plastic surgeons of the breast is scar tissue and hardening. However, if you have a textured implant and you have those symptoms, you got to be very careful about that ALC.
Is there, a lot of people, they go, get treatment now in a different country because it's cheaper.
Yeah.
Sometimes that can be sketchy, and I would assume probably with these just as well.
Yeah, I mean, we don't know what's being put in patients in other countries internationally, in Mexico and other places like that, so that can be very dangerous. So I recommend, if you're from America, you probably want to go to a board-certified plastic surgeon in the United States.
Is the technical word smooth and textured?
It is. That's exactly right. Smooth is soft, smooth coating. Doesn't have that reaction.
Right.
Textured's fuzzy. I've done over 14,000 implants in my 23 years as a plastic surgeon, and I have put none of these in.
Yeah.
Just because I didn't like the way they looked or felt.
Yeah. All right. Well, thank you so much. You're located in Beverly Hills?
Yes, ma'am.
Brighton Way and
Bedford Drive.
Bedford Drive. That's right. Well, good to see you.
Thank you for having me.
Thank you.
We appreciate it.
Appreciate it.
It's important you came in and gave that